Hello class, my name is Michelle Eckler, and for my medical terminology presentation I'm going to be talking about pancreatic cancer and what are some of the symptoms and risk factors that could lead to pancreatic cancer. Okay, so first we're going to look at what pancreatic cancer is specifically. So pancreatic cancer is a disease in which cancer cells form in the tissues of the pancreas. So the pancreas, if you are all familiar with anatomy, the pancreas is a gland located behind the stomach and in front of the spine. The pancreas produces digestive juices and hormones that regulate blood sugar, and cells called exocrine pancreas cells produce the digestive juices, while cells called endocrine pancreas cells produce the hormones. And majority of the pancreatic cancers start in the exocrine cells. So looking at some of the symptoms that are associated with pancreatic cancer, we have here, it says here mid-back pain, indigestion, not responding to prescribed medication, new onset diabetes not associated with weight gain, fatigue, low mood or depression, upper abdominal pain, pain on eating, jaundice, which is yellowing of the skin and eyes, possibly itchy skin, pale and smelly stools that don't flush easily, and unexplained weight loss. It's definitely important to really keep note about some of these symptoms, because a lot of the misdiagnoses that come from some of these symptoms are found to be gallstones, irritable bowel syndrome, indigestion, gastritis, gastroenteritis, liver disease. So how late is too late? Well, pancreatic cancer often has a poor prognosis, even when diagnosed early. Pancreatic cancer typically spreads rapidly and is seldom detected in its early stages, which is a major reason why it's the leading cause of cancer death. Signs and symptoms may not appear until the pancreatic cancer is quite advanced and complete surgical removal isn't possible anymore. So looking at some of the risk factors that could potentially put you at risk for developing pancreatic cancer, these include smoking, chronic pancreatitis, which is the inflammation of the pancreas, inherited conditions, including hereditary pancreatitis, and long-standing diabetes. After taking down your health history and performing a physical exam, the doctor may order several tests to determine the cause of your problem or the extent of the condition. And he'll do that by ordering CT scans, which is also known as computed tomography, MRI, also known as magnetic resonance imaging, endoscopic ultrasound, laparoscopy, which is a surgical procedure to look at organs, endoscopic retrograde cholangiopancreatography, and biopsy, which is the removal of tissue to view it under a microscope. There are various treatments for pancreatic cancer, including surgery, chemotherapy, and radiation therapy. Chemotherapy uses drugs to treat cancer, while radiation therapy uses X-rays or other kinds of radiation to kill cancer cells. Surgery can be used to remove a tumor or to treat symptoms of pancreatic cancer. So exactly what is the outlook for pancreatic cancer? Well, according to the American Cancer Society, they report that only about 23% of patients with cancer of the exocrine pancreas are still living 1 year after diagnosis, and only about 4% are still living 5 years after being diagnosed. So it's really important to get checked and to really recognize these symptoms, and if you have any of these symptoms, to really go see your doctor.